Well, the studies on childhood obesity have some conflicting results, with some suggesting kids are leaner now, while others point to an increase in obesity rates.
Experts say childhood obesity rates have actually remained steady, if not gone up. And the latest data shows 17% of kids are obese, 30% are overweight.
So joining us now, Dr. Garrett with the Previty Clinic for Surgical Care to explain how there can be lifetime consequences, right, for this extra weight.
It's a very scary thing.
It really is, yeah.
In fact, some studies have shown that preschoolers are improving because of some special programs. But when we look at the most recent data, it shows that there is a spike in childhood obesity in children aged probably 5 to 6 up to their teenage years.
Oh, wow.
And then if we look at teenagers, it's even a worse spike.
Wow.
And so what that translates into is an entire 2 generations of obese Americans. It's very scary because all of this translates into an unhealthy population as we grow.
Unhealthy future. So we hear a lot about body mass index with adults and how we can measure that. Do you do it the same way for kids?
A BMI for adults is calculated based upon the height and the weight of a patient. Essentially, a BMI of 35 or greater is considered very obese or extremely obese, and a BMI of 30 or above is considered obese. In children, it's a little different, and if we did that, we'd probably have even higher obesity rates in children. It's a similar equation, but then that is plotted on something like what we see in a growth chart, so parents are used to looking at that chart for their children. Consider this: a 10-year-old boy who weighs approximately 80 pounds, who's 4.5, 5 feet, is obese.
Wow, really? 80 pounds?
Yes, 80 to 85 pounds.
And this is according to the BMI calculation?
And this is according to the BMI calculation and plotting it on the curve.
Wow. So should parents then, what should you do with that information? I mean, how do you calculate that into real
Number one is to talk to your pediatrician, talk to your family doctor, because therein holds some accountability and also a potential medical plan. This is a medical disease. Obesity is a disease. It's like high cholesterol, hypertension, sleep apnea. All of those things are caused by childhood obesity. However, if we look at children, we see that children are responders to the environment, right? So they not only mimic our language, as we know too well, but they also
comes back on us,
that's right. They mimic our behaviors and potentially our sedentary lifestyle, and the advent of computers and iPods and all of those external environmental devices really do nothing for activity. So activity is very important, okay? So limit that use. Number two, a well-balanced meal is very important.
I mean, my kids eat what I prepare. And if I drive through McDonald's, that's what they're going to have for dinner.
And we are creatures of habit. We are also creatures of convenience. We all have busy lifestyles. And so a drive-through McDonald's should not be shamed. However, it should not be an occurrence that it happens frequently. So, and also portion control is very important. As you well know, we drive through McDonald's, a huge sacrifice, a big burger, even if it's a child's burger, it's a big burger, or lots of chicken nuggets that are full of chemicals and preservatives, etc.
And then usually not really chicken.
And for my children, they don't want orange juice or milk at 7 p.m. They want a Sprite or a root beer, and that's full of sugar. So again, what we are feeding our children is clearly causing the obese disease to become worse. And so in that essence, I think a portion control scenario is very important too. No need for a buffet at dinner. Fix your child's portions so that they're well balanced, that they are on a smaller plate. We also know that there are certain risks that are involved, like we talked about, the sleep apnea, the diabetes, the psychological problems. At the end of the day, it's our responsibility as parents, it's our responsibility as doctors to make a change for the better in this generation of children. We're going to have a life expectancy that is much lower when we are in our senior years seeing our children die young from obesity.
Good habits start young. You need to start them young.
It can be tricky though with kids, because I know people going through this and trying to do it without hurting their self-esteem is so critical.
It's very important. It's not. It's best not to label. It's best to basically
just change your
frame the situation as a problem that has a clear solution.
Let's get healthy.
Good advice.
That's right. All together.
Thanks, Dr. Phil.
Absolutely. Great to see you.
Here's a check of today's